Thank you, Kristen. Thank you, everyone, for joining us. Today is a Major to Career panel hosted by the Career and Experimental Education, the Center for Career and Experiential Education. So I see a lot of my students here, but for those who don't know me, my name is Marian Manuel, and I'm an assistant professor here in the interdisciplinary neuroscience program at URI. So as Kristen just mentioned, this panel will be recorded and will be put online. So if people weren't able to attend today, they'll be able to catch up later. And so we're going to have 4 panelists today who are alumni of the neuroscience program, and they're going to tell us about their experience. Maybe could each of the 4 panelists introduce themselves with their pronouns and their current position, and then we'll go through ask some questions to each of you after that. Let's see. Let's start with we have 5 panelists. Sorry, Grace, maybe could you start?
Yes. Hi, I'm Grace Heppes. My pronouns are she, her, hers. I graduated this past May in 2024, and I'm the Outreach Education Coordinator for the Center for Misophonia and Emotion Regulation at Duke.
Welcome. Negar?
Hi everyone, I'm Negar Rahmani. I go with she, her, and I graduated from Neuroscience program at URI 2021 with master. Currently, I'm a second-year PhD student at Boston University Neuroscience program.
Welcome. Ellie.
Thanks. Hi, everyone. My name is Ali. Go by she and her. I graduated the master's program in 2018, and I'm currently a consultant and scientific advisor at IQVIA's Patient-Centered Solutions Group.
Wonderful. Welcome. Victor?
Hey, good morning, everybody. My name is Victor. I graduated from the IMP in 2022 with a master's. I worked in the same lab as Nagar, actually, and it's a pleasure to be here.
Thank you, Victor. And Tracy. Hi, Tracy.
Hi, Dr. Manuel. Hi, everybody. So my name is Tracy Santos, she, her, hers. I graduated the IMP program in 25, and I'm currently a master's student here at URI still, working in the Dr. Quinlan lab.
Thank you, guys. Okay, so we have quite a lot of people to go through. I'm sure everybody has some questions. So can you tell us how did you get into this program? How did you get into neuroscience, and how did you choose which career path you wanted to pursue? Whoever wants to take it.
I can start. So I have misophonia. If you don't know what misophonia is, it's a decreased sound tolerance to certain noises such as chewing, sniffling. It's mostly orofacial sounds. And I've had it all my life, but it got really bad when I was 13. And throughout high school, I really wanted to get into the field and find a treatment or anything for misophonia because there's a lack of it out there. And so I joined the neuroscience program so I could learn more about the brain and understand it better. And then I started the position at the Center for Misophonia. I reached out when I was in high school. They told me I couldn't join because I wasn't Duke undergrad. But then I reached back out when I graduated from URI, and they just opened the Outreach and Education Coordinator position, and I applied and got it.
Nice.
I applied to the IMP. I actually went to University of Rhode Island as an undergraduate. I graduated in 2019, and my plan was to apply to medical school. And after having some conversations with Dr. Andy Simmons, who some of you might know, I think he's moved on to Brandeis. He was the pre-med advisor at URI. I talked to him about doing more research. I wanted to, I guess, curate an application that was a little more robust. And so I applied back to URI. I'm from Rhode Island, so it was convenient in that way. And I was really excited about neuroscience. My grandmother at the time was suffering from Alzheimer's. I was curious about that disease, and I wanted to, in some way, feel like I was working toward um, maybe not finding a cure, but advancing the research. And so I ended up doing a 2 year master's program, and I later applied to medical school, and today I'm in my third year medical school at Brown.
Okay, thank you.
Go
All right,
next.
nothing. Oh,
Do you want me to go next or we're done?
Sure, Negar, go ahead, please.
Yeah. So I have a bachelor in nursing and I was an international student when I get to URI. And then while I was undergrad, I had some research on neuroscience project, right? Working on anxiety and pain. And I really enjoyed it. And I really wanted to know more about brain and how it actually works. So I find that URI neuroscience program was really a good fit for me to learn.
Tracy?
yeah. So for me, the way this kind of ended up developing, so I've been in the military for about 12 years now. And there is a very high relevance of veteran suicide. And I wanted to learn more about that, not just in the psychological way, but like neurologically. And I think that's what got me involved in neuroscience. And URI had this wonderful IMP program that I've never heard about. And I went ahead and applied and I got into the program. And I actually got into the master's program while I was in Iraq. So I still do deploy, knowing simply because I knew that I wanted to continue this career and I wanted to kind of like advance research about PTSD, about suicide in these populations. And that's kind of how I got into this career path.
And Allie?
Thanks. Yeah, let's see, I came out of my undergrad knowing that I wanted to sort of go into the neuro route. And I did my undergrad in North Carolina and wanted to sort of come back home to Rhode Island. So the URI IMP program was the perfect fit for me for my master's degree. And after completing it, I took a position that was bench-based in a lab, and sort of felt out that that wasn't the right place that I wanted to spend my career. And after that, took some of my skills from the IMP program and worked towards a more research focus, but from a desk instead of a bench base, and have really, really enjoyed being able to do that instead. So a bit of a more circuitous path there, but that was the whole of it.
Great. Thank you. Thank you so much for sharing, all of you. So yeah, we have a wide variety of kind of care path here. We have some people still working in the lab, some people who worked in Victor in the hospital, and Ali in the private sector, Grace in an outreach role. So maybe Grace, do you want to start? What's your typical day? Like what do you do in your typical day? And like, do you interact with patients a lot? What can you tell us about your day?
So I don't really interact with patients much. I have some interactions with participants who participate in our research studies at the center. But my typical day is I do a lot of communication-based stuff. So I run the social media, our website, and I answer a lot of emails and messages that we get through the center. And I'm able to relate to the people who are messaging us. So it's nice to be able to tell them that from firsthand experience that there's hope and that there's hope in getting better. And even though there's not a lot of information out there. So that's a lot of what I do is outreach, and I reach out to organizations all around the country to inform them about misophonia. The main purpose of my position is to raise awareness among healthcare providers specifically. So I reach out to a lot of healthcare provider organizations and set up webinars with my boss, Dr. Zach Rosenthal. And yeah, it's a lot of communication based, but I've also written some neuroscience based. I wrote a proposal for the ICD-11 for misophonia to be an official diagnosis. So that I was able to write the neuroscience part of that. So that's pretty exciting. But yeah, my
Wonderful.
day-to-day is mostly communications.
So Nigar, are you still working in the lab? What's your day-to-day like? Like, can you give us like just a very quick overview of what you're doing and what kind of like science you're doing?
Sure. So I'm working in the lab, and my work is mostly like bench work. It's a bit different from what I have done in URI, which was more biochemistry focused. Here I'm doing more system neuroscience. So my day-to-day work is very different from beginning to the project to the end of the project. So it's the first is we design the project, like how it's look like. And I'm working in vivo, I'm working with mice. So we have to do surgeries on mouse brain, inject some viruses, let them to be expressed for 2 weeks. And then while I'm waiting for that, I'm like involved in other experiment, like doing cell cultures or like any other like a small experiment like cloning. And then when the virus is expressed, we start the behavioral assays for mice. So I'm working closely with mice, handling the mice, doing a lot of behavioral and also like sacrificing or euthanizing the mice. And then the experiment start afterwards with the staining IHC, which will look at the brain sections and the expression of some protein and how they localize. And at the end is analyzing the data and presenting to the meetings. So that's how every project is starting from beginning to the end. And my daily life could be differ, like depends on which part of project I'm at.
Mhm. Great. So then we have Ali, who work now as a consultant. So I'm guessing your day-to-day life is very different from Nigar's. What are you doing in your day-to-day life?
Yeah, it really depends on sort of the projects that I'm working on at the time. So we do a lot of secondary research, but also some primary as well. So, like right now, I'm working on a study where we're going to actually interview some clinicians. So I've done clinician interviews. I've also interviewed patients as well. So I do have some patient-facing experience, but a lot of the secondary research that we do is my day to day. So it might be reviewing, like the current literature that's out there on a specific type of cancer, or, if I'm lucky, I get placed on a neuro project as well. So we might do that and sort of putting together a presentation for the client on what the landscape looks like in the literature, or what the landscape looks like in the clinical trial space, what sort of drug labels have been out there for any particular disease or disorder, and helping them sort of guide their decisions and what they might want to implement in their own trials that are going on or coming up as well. So definitely vary day to day, but I spend a lot of time in PowerPoint, a lot of time in Word, putting together things for our clients.
And who are your clients? They are pharmaceutical industry?
Yes, mostly pharmaceutical. We get some med device as well, but it is typically your common pharmaceutical companies.
Okay. Thank you. Victor, how's life as a future physician?
It's fun. It's fun. Every day is exciting. I think what your day-to-day looks like really depends on where you are in the program. And so the first 2 years, first year and a half or so are really dedicated to your pre-clerkship and everything before rotations. And so that consists of studying, doing practice questions. In parallel to that, learning clinical skills like medical interviews, physical exam skills. And so the focus is really on acquiring knowledge. And thereafter, in third year, which is what I'm about to begin, you'll actually start to go on rotations at different hospitals. And so surgery at Rhode Island Hospital, pediatrics at Hasbro, et cetera. And this is where you'll actually put some of this content knowledge and these skills into practice. So you'll work alongside physicians and interview patients, manage their care, have conversations about essentially all of the things you've learned to that point, and then maybe take it a step further. So I'll be starting rotations in about a couple of weeks from now. I wish I had more to say on it. I haven't actually started. So.
So I see on your bio here, you're founder of Sprout and STEM. Can you tell us about this?
Sure. That was, Sprout and STEM is a 501c3 nonprofit that I had started the year before I applied to the master's program in the IMT. And so that's something we've continued to run, some of my colleagues and I. I'll put the website in the chat. But it's a program that's focused on academic interventions in local schools throughout Rhode Island. So we provide tutoring and mentorship to historically disadvantaged students, and predominantly in science and math.
Right. Thank you for doing that. That's great. Tracy, what are you doing all day?
So I think there's a lot of different things that I get into because of the different jobs and titles that I hold. But one of them is, of course, here working with the Manuel Lab as well. But I study serotonin receptor expression in the spinal cord of rabbit models of cerebral palsy. So most of the days I'm doing immunohistochemistry, I'm doing Western blots. I'm just trying to get results, right? Make research happen in the lab. And when I'm not doing that, I'm flying. So another aspect of my job is I am a combat medic in the Army Reserve. So I do see patients with a specialty in neurology. So I see patients very often, especially when I go and deploy. There's probably nothing more rewarding than being on an aircraft saving lives and being a part of that. A lot of patients that we see are, IED victims, VBIDs. Now, war is looking different, so we're seeing a lot of suicide drones. So a lot of that we're seeing, at least out there, and the patients that I'm seeing, unfortunately, do have like TBIs and are blast victims. So my neuroscience background has really helped me with that, especially when I'm out there trying to make them better. So yeah, I
TBI
fly.
is traumatic brain injury.
Yeah, that is correct. So I see a lot of patients that unfortunately have that. But yeah, so if I'm not flying, I'm teaching. I'm seeing patients, or I'm here trying to make serotonin receptors expressed in the spinal cord. So a lot of different aspects of what I do, but I love it all. So
okay. So how do you feel like your training in the neuroscience program helped you in your current career, and like, do you feel like it gave you like a leg up on when you were applying for your current position? Is there any like specific skills that you acquired during your INP training that is really beneficial for your career? Tracy, since you're MC, you're on my screen. Do you have something to say?
yeah, no, absolutely. I think a lot of the classes that we take in the IMP program, especially like our 101s and our 262s, are very beneficial. Like I said, I work in a lab now, and a lot of these techniques that I'm using, like immunohistochemistry and Western blot, is something that we learned as an undergrad in our 262. And it might have not been very in depth, but because I had that background, I'm now able, as a research assistant, my mentors feel comfortable letting me do what I have to do as a graduate student, knowing that I have that background and I understand about like Western blots and immunohistochemistry and all that good stuff that I'm doing here. As far as a combat medic, of course, when I'm seeing patients or when I'm talking to the physician about what I see, a lot of that has to do with what I've learned in the neuroscience curriculum, especially when I'm telling them the characteristics of what's going on with a patient. These are all things that I've learned because I'm able to understand what's going on in the mind. And I wouldn't know that if I didn't obviously have the wonderful classes that I had, some of them with you, in neuroscience. So I think it's really advanced me as a leader, not only in my military career, but even here in the lab among my peers. So.
Anybody else want to comment whether like you feel like your training really help you in your career or finding a job?
I can jump in here. I think there were a couple of things, even though I'm not like at the bench anymore, and that was what I primarily did as part of my master's degree. I think a good understanding of how to critically appraise a scientific project. So looking at a piece of literature and saying, okay, what did they do here? How did they get here? Were their methods sound? That's something that I absolutely had to do as part of my master's degree, but it also was something that I had to do myself as part of, writing a thesis and putting that out there. And the second thing is tied into that, which is learning how to be defensible for the work that you do. So having to present, a thesis defense and say, hey, this is the work that I did, and this is how it came out, and these are what the results are, and this is how I think it applies in the real world. It's something that I do almost every day with the work that I do, and it's something that I did a lot throughout my lab work was, going to those lab meetings and saying, hey, this is what we found. Here's what I think it means. Here's what I think we should do next is absolutely a transferable skill that is, I think, important to everyone, but comes up quite a lot here in my real world job. So really thankful to have gotten those skills at URI as part of the IMP program for sure.
Wonderful.
I guess out of curiosity, if the students in the chat wanted to raise their hand, but how many of you are interested in pursuing medical school? To get a sense of.
A couple.
Yeah. Oh, nice. Okay, great. Yeah. I'm just gonna send a figure to the chat. I know I'm bombarding the chat. I came across this figure while doing some research on when students make the decision to pursue medicine. And if you look on the far right, you'll notice that an overwhelming majority of students make the decision to pursue medical school in either middle school or high school, around 60%, followed by 20% in the first 2 years of undergrad. And I bring this up because I think the earlier you make this decision and stick to that plan, the more time you have to essentially prepare yourself and pursue experiences and opportunities like shadowing, clinical experience. Essentially, the more it's an advantage having additional time to prepare for medical school. And I think in my situation, I came to this realization a little bit later. And so I think a lack of research experience ultimately prompted me to pursue a graduate degree, along with the other reasons I already mentioned. I felt like a lack of research was really my Achilles heel at the time. And so I think if you're interested in medicine, dive in now, find mentorship. I'll add my email to the chat later if anyone has any questions after the fact. But I think for me, doing a master's was a real leg up and really supported my application in getting accepted.
Do you know if you want to stay in the like neuroscience? Do you want to be a neurologist, or do you don't know yet?
I've kind of pivoted away from neuroscience. I do love neuroscience. Still read about it on occasions, but right now I'm leaning towards general surgery. I'm really interested in xenotransplantation. Maybe some of you have heard about how a couple of surgeons at Harvard a few weeks ago transplanted a pig kidney into a human recipient with end-stage renal disease. So I'm very interested in transplant surgery.
Awesome. I think this is a question for you actually from the chat. Do you feel that you did a lot more research than the research experience that you had at the INP before you got into medical school?
I would say this. For me personally, I felt like I did have to do more research, but I can speak to what's happening at Brown. Brown is taking on more of a research focus, I think, when they filter out applicants. And I'd say that because historically it's been a very service-based or community-based type of school that's very deep into primary care. And so they've always felt like applicants who have less research, maybe that's not so much of a problem. But when you look at Brown and how it's kind of positioned between Cambridge and New Haven, Harvard and Yale, it's realized that it needs to invest more in research and prioritize that more amongst its applicants. And so I think having a strong research background as an undergrad is important. But I think the key takeaway there is that it doesn't necessarily have to be research in the biomedical sciences. What they're looking for is something that you really care about. And an example that I heard of, I think it's a wonderful example. So I heard of this undergraduate. She was a music major, music biology double major, and she wanted to investigate the effect of music therapy on stroke victims and whether it resolved some of the cognitive deficits that they had experienced. And so she combined a couple of different interests and gained some research skills in the process. So as long as you get yourself involved in research, I think that's the most important thing.
Great. What about Nigar and Grace? Do you have is there some? Can you comment on whether your training really prepared you for your current position?
Yeah, in terms of going to PhD program right after, I think we have in IMP we have very good professors and labs that you could work with. I work directly in Dr. Jody's Camberg lab, and I think the training I got in the lab, as Victor did, it was pretty strong and very good, and very prepared me like to get to my next position, which I was RA, like research associate. Right after graduation, I went to a biotech company, and it really helped me to get that job at first place, even though I didn't have a lot of experience in vivo, because they looked at my resume and they saw like my really strong research experience while I had at URI and INP. They offered me the job, and I was there for 2 years. And adding to that, having really good relationship with people at URI helped me to get like a really good recommendation letter for my next position, which is a PhD program at Boston University. And also the experience and research I had in my master really helped me to get to the point that I'm here. So I would say yes. I don't think I wouldn't be here without having a master degree from IMP. So it really helped me.
Thank you.
I relate a lot to what Ali said, where reviewing scientific papers. We took a class, I can't remember the number. I think it was either 110 or 210 with Dr. Albert, where we learned how to go through studies and find out if it was a good, valuable paper or not. And that has helped me a lot because the misophonia research field only started like a decade ago. So there's a lot of new papers coming out right now, and it's easy to get excited about a new finding, but you have to really look into the paper and say, like, is this valid? Was this empirically reviewed? Like, is this really worth telling everyone about? And is it like a true finding? So that has helped me a lot in this field because it's so new, especially that being able to decipher whether a paper has good findings or not has been really helpful.
Mm-hmm. Right. So since you're working in this field that you think is really new, like for our undergrads here who are present and who will enter the job market in the next few years, like what do you see is the biggest trend in your field? Like, is there something that's really emerging as a potential treatment or as something that's really exciting for you that's coming up, and you feel like it's coming up in the next few years?
So there's been a huge focus on CBT therapies for misophonia. That's kind of the main focus right now. And a lot of people are looking into neuroscience and brain images, and it's hard to tell right now because there hasn't been a lot of studies with control groups for brain imaging studies, so we can't really tell. But I would say the most promising is CBT therapies, but avoiding exposure is a huge thing for misophonia as well, because avoiding habitual exposure, especially without, I think, exposure with teaching people how to do skills and working with it, not just listening to their trigger sounds, that has been shown over time to be be quite harmful for people. So steering away from that, which was the original plan for a lot of psychologists, and going over into CBT, other CBT therapies besides exposure and response prevention. That's exciting, and we're looking more into that. And I think that we're avoiding just trying to look for things in the brain and are looking more at behavioral responses.
Great. Thank you. Anybody else feel like there's really like some really exciting development that's going on in their field, and that's really gonna explode in the next few years?
I think artificial intelligence has the potential to transform how we provide primary care through a variety of ways. I think one is ambient AI, and so using smart microphones that capture patient encounters and help create the medical notes to alleviate the kind of take to do that. There's also ways we can hopefully streamline communication between primary care providers and patients through chatbots, smart chatbots, symptom checkers. And so essentially you can think of like WebMD or ChatGPT on steroids that's able to help support a diagnosis and recommend whether the patient's symptoms are acute and urgent and they need to go to the hospital, or whether they can stay home and treat themselves with ibuprofen. So yeah, I think artificial intelligence in medicine and basically every other sector has a ton of potential. That's what we're talking about now at this point.
Thank you. So Nigar, for example, I'm gonna put you on the spot, but you talked about using viruses in your work. Maybe can you, like, this is kind of a new tech. I mean, I know it's not so new for us, but in the grand scheme of things, it's a very new approach that is really powerful to use in mice, but it's starting to come to the clinic as well. So can you discuss about how this is working for you, and what you can do that you couldn't do before with these techniques?
Of course. Yeah, this is very cool and very interesting techniques that has been very popular in the last 10 years. The techniques is used the virus to label the cells while the mice is learning something. So this technique is, I'm actually studying learning and memory. So mice is in a context. So we put the mice and they got fear conditions, so they get a very little shock, so they actually making a memory of what is happening around them. And while they are actually fearing like feeling this condition, there are some cells in hippocampus that they're turned on and they actually increase the activity. So what this viruses does is they actually use CFOS, which is an early transcription factor that turns on, and it actually like it attached with some sort of fluorescence tag, and it light up the cells that already been active during that condition. So it's pretty cool technique. And the another technique we are going to use in the future is optogenetics. So we kind of manipulating the cells by just lighting up on the cells and turn the cells on and off by some new viruses. So these techniques are very now being used in mice. The thing is, in the future, yes, there are opportunities to use this new and novel techniques in humans, but as our professor tell us right now, that in neuroscience field we are very at the beginning. So it's like physics like 100 years ago. Like we are just learning this about brain and we don't know much yet. We know a lot, but not that much that we could like bring everything to the human. So there's hope to use this type of injection in unlike humans in the future, but not right now because of the invasive part of the injections. That makes sense.
Mm-hmm. Yeah. yeah, lots of very cool work being done with viruses, and like to be done in the future. Like there's so many new opportunities that are opened up by these technique. Anybody else want to comment on like something big coming up that you can feel is gonna be huge in the future?
I will say neuro-related, there's a lot coming through for Alzheimer's. I think it's still going to take some time, but I do have the privilege of being able to see sort of what's coming up in the drug development space, and Alzheimer's, still a lot of work happening in that area. But I'm also really interested to see what's coming up in the psychiatric drug disease space. There's a lot of movement there. I think some of the, I don't want to say guidelines have been changing, but the way that we measure change in a lot of those disorders has been changing over the years. And I think we're going to see quite a few things in the next decade or so in that space.
That's exciting. Thank you.
I'd like to chime in as well. That's all right.
Yeah, of course.
So I think, speaking on that, there's a lot of development going on with cerebral palsy, right? Cerebral palsy is a group of, lifelong disorders that pretty much inhibit like, movement and posture. So the way that these patients are living is very uncomfortable, right? So here in our lab, we're working on different ways that we can create better treatment for those that are suffering from cerebral palsy. And I think something that's really exciting is the fact that the number one comorbidity with CP is pain. Of course, we could see that. And something that's exciting that's going on in the lab that I think we are one of the first labs to do this is find the relationship between nociceptive pathways and motor pathways, right? So figuring out kind of, is pain a comorbidity of cerebral palsy, or is it something that's occurring on its own? Because that can change the way that we treat patients as well. Knowing if it's caused due to the hypertonic nature or characteristics of cerebral palsy, or is it something that's happening on its own? And that's something that we're starting to do with looking at serotonin expression, how I mentioned before, in the spinal cord. And I think it's really exciting because we can really change the treatment of those that are suffering from cerebral palsy. And I think that's really exciting how we're trying to figure out pretty much those pathways and how they work with each other or how they're working alone to figure out that better treatment.
Great. Thank you, Tracy. All right, and then is there something that you wish you knew before you graduated college, or what advice would you give to our young audience today before they get into the workforce? Is there something you wish you knew, you wish you had done, or you must do before they graduate? Anybody want to take that?
I can say something. So if you are working in the lab and part of a research project and you're involved in different, you try to be involved in different project, even a small, and try to have more publication if you plan to apply for like PhD or grad school afterwards. So it doesn't mean that you have to do the whole project. It just need to be like you could be involved in different parts, just increase your publication for future applications, just boost your application in the future for more competition.
Yeah, I would just probably say the whole process, the application process is super disorienting. So do your due diligence and read up on some strategies that can make your application more efficient and save you time. And just try to find mentorship. I think it's really important to find good mentorship. It's hard to, but network, socialize, and reach out to people who can hopefully share their wisdom and experience with you.
Something I'd like to mention is don't rush the process. There's so much pressure at this time right now to have everything figured out, right? But life is not linear. So it's okay to take your time to pivot, There's probably some of us in this panel that have changed their course plenty of times before they figured out that this is what they wanted to do. So I want you to also understand to take care of your mental health. Don't rush the process. It's gonna happen for you. And then the biggest thing is build relationships, not just resumes. So kind of like what Victor was talking about, please make sure that you stay in contact with your mentors, classmates, the people who've inspired you. These are the same people that are gonna write your letters of recommendation. These mentors might be the ones that say, hey, this job is opening here, and I know that you were interested in this research or whatever the case may be. These are the people that are going to really, really help you. If there's anything I can say about my story is that it takes a village is real. It's taken a village. I still have that village, and I'm still learning, and I'm still pivoting. You know, even now as a senior in my master's program. So I think it's really important for you guys, especially as undergraduates, to remember that and stay curious and keep learning. Go to that research lab that maybe you weren't interested at first, but you're like, maybe I can go into that. Like I said, I wanted to study PTSD, and right now I'm studying cerebral palsy, right? But at the end of the day, I'm learning so much here, and I'm gaining these experiences, and it's just going to build my resume, and I'm building that knowledge, and that's something that you all will have the ability to do, especially here at URI and beyond. So
I want to bounce off of that a little bit. So same with the networking, like please don't be afraid to reach out to people. I was on Rotathon for all 4 years. That's how I got on there. Was I DM'd their Instagram account to join my freshman year, and same thing, I emailed Duke when I was a senior in high school, and now I'm working for them. So don't be afraid to reach out to people and network. And also don't be afraid to just try things, especially while you're an undergrad. I volunteered at a hospital under a neuroscience PA, and that's how I realized I don't want to be a PA in a hospital. And that was such valuable information to learn, to be in that setting and volunteer in the hospital and realize that that's not what I wanted to do, which people would see that as like a failure, but that actually helped me so much in learning what I actually wanted to do in the future. So don't be afraid to try those new things.
I think my advice is pretty much along the same veins as everyone's. It's been great advice, and that staying open and staying curious is really important. I never knew that a job like mine existed until I saw the opening and went for it. There's so much out there, and there's so much available to you. So definitely staying open, trying different things is really important, and the networking is huge. I got my first job in this field actually through messaging another URI alum on LinkedIn and being like, hey, I see this job open, I'm interested, anything you can tell me. So the networking is a really big piece of it, and that can happen anywhere. It can happen through URI, through your friends. So staying open in that way too, and trying to find mentors anywhere is absolutely something that I would keep in mind.
Yeah, I think for my part, I would say like yeah, not everything is for everybody, and so it takes time to figure out what you want. Some people like to be at the bench, some people like to be in contact with patients, some people like to be alone in front of their computer. So there are many ways to find your niche, and so trying it out and like going to the labs, seeing what kind of work your different instructors are doing, and like trying to get a feel about what's really interesting to you and really like captivates you is a process that you have to go through so you can find what you want. All right, I think we're gonna have to wrap up soon. So is there any questions from the students in the audience? Do you have any specific questions you wanted to ask some of our panelists or to the panelists in general? So please free to unmute yourself or type in the chat. Carolyn, I see you raise your hand.
Yeah, I just have a question about research. I was wondering, what's your thoughts on doing research that might not be like even related to like the medical field? Like, I'm really interested in going into bee research, but I don't know if I should stay away from it because I want to go to medical school. So if I should focus on something more, in that realm.
Yeah, I'm happy to answer that. Yeah, I think this kind of touches back on one of the comments I made earlier. I think if you're interested in a particular area of research, and you're able to talk about it, it's exciting to you, and you gain some research skills in the process. I don't think that that's a red flag for admissions committees at medical schools. I think at this point in your academic career, it's really just important for you to be familiar with research, how it's conducted. And if anything, I think the research sounds really interesting. I think that would probably get the attention of an AdCom. So, yeah, I would say do it.
Got a question from the chat here. Where would you suggest looking for mentors, and where have you found them? Is it like mostly your professors in from your classes, or who did you reach out to?
I kept a close relationship with Dr. Wyatt, the director of the IMP, because I was a URI 101 mentor my sophomore year, and it was for her class, so I stayed in touch with her. But even if I wasn't a URI 101 mentor when I took her classes, I just kept in touch with her and constantly asked her questions and just try to be active in communications with your professors and build a relationship with them.
I'd also like to say that, sometimes you find mentors in unexpected places. Sometimes a mentor could just be somebody that's a couple steps ahead of you. When I was in undergrad, I knew someone that was working at a lab that they were a master's student and they became my mentor. It doesn't have to be like this overpowering person, but of course, they could be your professors. It could be that person that takes the time to talk to you outside of the classroom, or somebody that was able to see your potential and you continue to talk to or reach out to, somebody that's doing the research that you're interested in, and you reach out, and you started working in their lab. Your mentor could be anywhere. It could be people that you meet in student orgs sometimes, because of course you should be getting involved in student organizations on campus, and doing all of that stuff. So a mentor really could be anywhere. A mentor could be a peer that's doing something outside of school that you're really into. So
Got another question in chat. Broad question: is there something you wish you would have done differently? Oh, everybody's very happy with their choices. That's good. Any other questions? All right. Hearing none, please take the time to thank our panelists, Grace, Negar, Ali, Victor, and Tracy for taking the time to tell us about their career and trajectory. And I hope you learned some valuable information. And yeah, I think if you want to know more and you want to reach out to our panelists, I think they'll be happy to answer your question.
I'll drop my email in the chat.
I'll do the same. Thank you guys for having us.
thank you so much, everybody.
Thank
Thanks,
you
everyone.
to our local panelists, and especially for coming back so many times. I've asked for you to come back multiple times, so I always appreciate it. Thank you for putting your emails in the chat. And with that, I will stop recording.